we see more and more that Alzheimer's disease is a complex disease, and we have, besides the complexity of AD itself, we have Alzheimer's diseases. This concept starts to emerge in the literature. We've seen, for example, a very interesting paper by Giovanni Frisoni published in Nature Reviews Neuroscience last year that proposes 3 Alzheimer's diseases according to the weight of genetic susceptibility. You have autosomal dominant Alzheimer's disease, you have the ApoE4 positive Alzheimer's disease, and you have the ApoE4 negative Alzheimer's disease. So 3 subtypes of Alzheimer's that could be interesting due to different proportion of genetic weight in the disease. So we start to see that we may have subtypes of Alzheimer that may respond differently to our drugs. That's the first thing. The second thing is the co-pathology data that emerged in the last years. We realized that actually pure Alzheimer's disease is rather the exception than the rule. So we have more patients with a comorbid pathology than patients with pure Alzheimer's disease. So every patient that we treat, we also need to keep in mind that he has some other comorbid pathology that will not be handled by anti-amyloid therapy, for example, if they have a comorbid vascular disease, comorbid synucleinopathy, comorbid TDP-43 proteinopathy, etc. So Alzheimer's diseases, comorbid pathology are really emerging now in the field. And of course, that leads to precision medicine. We need to do this kind of precise diagnosis. What subtype of Alzheimer's disease has my patient? Is it a subtype with ApoE, without, with a strong genetic background, without? And does he have any comorbid thing? That's the first thing that we try to see now, that we start to see now, and we will probably see better in the future years. So with better defined diseases in our diagnosis and in our patient, that will lead to better design trials, and of course lead to better benefit risk information for each kind of drug, each kind of disease subtype for our patients. So clearly, the precision medicine thing is moving forward, and we need to keep pushing in that direction because it's really what the current data tell us. Alzheimer is much more complex. It has variety, and our patients are as well. So we need to take that into account when we think about therapy.